So childhood cancer in general it's not common. It's not a common condition, but it's one of the leading cause of childhood mortality. There is an annual estimate of about 4 million in the entire world. So in the Philippines, we don't have really a cancer registry, but so far the data that we have, there's an estimate based on the registry that they have that about an average of 5,000 children will actually get cancer every year. This might be an underestimate because that 5,000 coming from the registry is actually those that are diagnosed. So we don't, the part that the children doesn't even reach the hospital to be diagnosed might not be represented in that 5,000. So the numbers can actually go higher. So the most common cancer in kids is leukemia. So we have the acute lymphoblastic leukemia and the acute myelogenous leukemia. And then so these are the liquid cancers, so blood. Next, the second most common cancer outside of the blood is brain cancer. So the CNS, central nervous system cancer. Any tumors coming from the brain to the spinal cord comes from there. In the Philippines, the next would be lymphoma, for which Hodgkin's lymphoma in the teenagers is common, followed by retinoblastoma, the cancer in the retina, the eye. We see it in babies up until 5 years old. That's the peak incidence. And germ cell tumor is also common. We also have Wilms tumor, which is the most common abdominal tumor in kids 3 years and below. We see that childhood cancer, some of the statistics, like for example, we take into as an example, acute lymphoblastic leukemia. So in ALL, which is the most common type and most curable childhood cancer, survival can be as high as 95% and above. That is coming from other countries. But in the Philippines, we see that the statistics goes down to 60% or as low as 10 to 20%. And then the reason for that primarily is because of delay in diagnosis. Seeking consultation late, there is a delay in diagnosis, and then once that the child is already diagnosed, it may be secondary to inappropriately staging. So there is lack of staging in such a way that you are not able to really stage the patient appropriately, and thus not able to give the best treatment. And actually, one of the main reasons of treatment failure in our country is what we call treatment abandonment, which is actually specifically when we define treatment abandonment in kids with cancer, it's skipping treatment for a period of 4 weeks and more. And actually, that missing 4 weeks in your child can have a lot of impact there. Missing treatment can actually lead to early relapse and then the cancer coming back. So those are one of the reasons why there might be, as you mentioned, disparity towards treatment outcomes in our country. Yeah, so there's a lot of factors affecting treatment abandonment, and yes, it boils down to the knowledge, information that are given to the families about how to continue treatment, what the disease is about, that's number one. Second, we can say treatment abandonment from potential side effects. So they experience side effects such that they don't want to continue treatment. Third, of course, we cannot not mention the financial burden of the catastrophe that cancer actually can give to the family. So in Makati Medical Center, we manage cancer holistically such that it's a multidisciplinary team, multidisciplinary treatment depending on the specific type of cancer. We only not look at the disease itself, but we make it a point that the parents and the family is involved. We look specifically for pediatrics, we look at beyond the cancer, making sure that they get to enjoy the sense of normalcy, ask if they are able to go to school, ask if the particular family or child needs psychosocial support, which is very important. Ask if the particular parent needs financial assistance, which MakatiMed can as well offer. And there are other, in terms of, like there is a patient navigation system in MakatiMed, although it's just starting, but its aim is actually to support the family towards the cancer journey so that they don't abandon treatment, they complete treatment, and the survival is good.